Well, hello everyone. My name is Drew Preston. I'm the communications coordinator for Medicaid and long-term care with DHHS here in Lincoln. Thanks again for inviting DHHS to this event. This is my second time at this training. Had a really great time last year, learned a lot of new things. Excited to be back again with you all this year. I'm going to speak mostly on Medicaid, kind of overview of what it is, how people are found eligible, and what services it covers. We have another person from DHHS, Darla, who will speak later about some of the more economic assistance benefits. So I'll start off this morning with Medicaid. So Medicaid is a state and federal program that provides health services to low-income individuals. It can be children, families, and seniors, especially in addition to those folks with certain health needs. It's one of the state of Nebraska's largest expenses. It's one of the biggest programs in most states that you visit. Ran about $2.1 billion last year in the state budget. I like to always call out early on in these presentations the difference between Medicare and Medicaid. Those are commonly swapped for some folks. Medicare is available for basically everyone in the U.S. Over age 65, and Medicaid is more focused on low-income individuals. This slide here gives a quick snapshot of our current enrollment for Medicaid. As you can see, the right-hand side in the green is children. They make up 2/3 of our current enrollment. You might have heard of CHIP, the Children's Health Insurance Program. Here in Nebraska, CHIP and Medicaid are ran side by side in effect for a child receiving health services. There really isn't any difference between CHIP and Medicaid. It's just kind of how the state pays for their services. So that green portion you see there is CHIP children and conventional Medicaid children. The remaining third is the blind disabled, 15%. The age is 8%, and parent caretakers is that remaining 11. Parent caretakers, I like to specifically call out. Those are individuals who they don't necessarily have particular severe medical needs themselves, but they're caring for either their child or another family member whose care needs may be so intense that that parent needs to take care of that child or family member full time. So because of doing that, that parent is eligible for Medicaid, even if they don't have any particular medical needs. They'll just be low income and also caring for that family member. So if you're working with someone deciding whether or not to apply for Medicaid, these are the main eligibility criteria to consider. You do have to, first of all, apply for Medicaid. You can request an application from DHHS, but they don't send them out, so you have to request one from DHHS. You do have to be a U.S. citizen and Nebraska resident to be eligible for Nebraska Medicaid. I specifically like to call that out when I go visit places like Sioux City and Omaha, where there's lots of caseworkers who might be helping folks in multiple states. They do have to be a resident of Nebraska to receive Nebraska Medicaid. You do have to have a social security number as well, so we can verify your ID. The remaining half of this list here, I like to advise that it's more of a case-by-case basis. They might not affect everyone. It really just depends on your current situation. So for instance, if you're a parent, you're working with someone who's a parent, their cooperation, and they have child support, we check to make sure they're cooperating with that. Living arrangement would be like your household income, who's living with you, who's outside of your home. That might impact your eligibility for Medicaid. Third-party medical payments is something where, for instance, if you're in some sort of accident where someone else is at fault, Medicaid is the payer of last resort. So if their insurance policy would be liable in some way or another for your injuries, we let that policy pay first, and then Medicaid comes after that. But if you're working with someone deciding whether or not to apply for Medicaid, I'd say focus more on the top half of this list. Second half is more of a case-by-case basis. So before we get too far, I did want to discuss Medicaid expansion that's currently in the works here in Nebraska. Last year, voters passed Initiative 427, which calls for the coverage of adults 19 to 64 earning up to 138% of the federal poverty level. This year, that's about $17,000. That's tied to the FPL, which is adjusted year over year. Doesn't move much, but this year that's at about $17,000 for an individual. That amount ramps up depending on your household size. The state estimates that about 90,000 people will be newly eligible for Medicaid in Nebraska through this, which is increasing our enrollment by about a third. Our current enrollment, should have mentioned this on a previous slide, that pie chart was about 240,000 people overall. That's about 12% of the state's population currently. And so with this additional group, we'll be ramping that group up by a third to nearly a little bit over 300,000 people might be eligible for Medicaid moving forward here. So in the past, kind of like I mentioned with the parent caretaker group, I like to call them out for this reason. They did have to have a child, someone they're taking care of, to be eligible for Medicaid. So if they were just low income but didn't have any dependents they were taking care of, they weren't eligible for Medicaid in the past, but they will be under this program. So you could have a single individual, maybe a low-income couple that don't have any kids. Those folks would be eligible for Medicaid through expansion. The program is launching October 1st of 2020. The state will be accepting applications for this group 2 months before that on August 1st of next year. So moving forward here, once you help someone submit an application, we look at that application, and those folks are grouped into one of two kind of main groups on Medicaid. Those are called MAGI and non-MAGI. MAGI is something new with the Affordable Care Act. It stands for Modified Adjusted Gross Income. It's a budget methodology, if you will. It kind of ties their income to their tax filing status. It helps verify your eligibility for Medicaid. It also closely ties to the marketplace as well. The MAGI group on the left here, those are groups that make up most of our current enrollment. And these are folks that they don't necessarily have particular medical needs, but it's basically just their income that qualifies them for Medicaid. So that would be children, parent caretakers, like I mentioned, who don't have particular medical needs of their own. They're just taking care of someone. And some smaller groups underneath those as well. Non-MAGI, you do also have to be low income to qualify for one of those groups. But there are also, they might also have particular medical needs or an emergent situation that might kind of tack on to their income status, their economic standing. One other important difference to note between these two groups is that MAGI, we only look at income. We don't look at other resources that you have. But for non-MAGI, we look at not only income that's coming into your household, but also resources that you might have, savings, other things like that. There are a number of exemptions to that. Like we don't count the house you live in against your resources or your vehicle that you take to and from work. But for the non-MAGI groups, like the age-blind, disabled, long-term care, we look at the resources that you might have in addition to your income. So this is a quick snapshot of this document that's at that link there on the bottom right. It's a great quick reference tool that I think many of you here might find useful. This is a income chart that is a kind of a quick reference. If you're working with someone thinking about applying for Medicaid, you can find out how much money they have currently coming into their household. Use this to see if applying for Medicaid might be worth their time. Across the top there are the federal poverty level percentages associated with these Medicaid groups. And on the left-hand side is the household size. So you can do a quick reference that maybe you're working with an expecting mother. So you can go to the pregnant women category, which is at 194% of the federal poverty level. Say they have a household size of 3. So you can go down there. That would be at $34.49 per month. So you can kind of use that to find out whether or not they should apply for Medicaid. But I do like to point out that this isn't the end-all be-all. So if they're kind of on the periphery of these figures, maybe it's slightly over, it's still worth your time to apply for Medicaid. This isn't the end-all be-all. Kind of just a quick reference guide to see if you're you might be way over the category. But if they're close to these figures, it still might be worth the time to apply for Medicaid. The two smaller groups, smaller boxes on the right-hand side there, those are primarily programs for, the bottom one is for seniors, and then the top one there is the Medicaid for individuals working with disabilities. A relatively small program, might be some changes coming to that. And then this is other screen grabs from that document I pointed out that's out on our website. These are resource caps. So you'll see for if you're working with a senior citizen who might be applying for Medicaid, they are subject to resource caps on top of their income. For an individual, it's $4,000 of countable resources, and then for a couple, it's $6,000. But like I said, there's a number of exemptions to those figures. So you're helping someone apply for Medicaid. They apply, they're found eligible. The next thing you might be wondering is what services are available to them. Nebraska Medicaid, all Medicaid programs across the country, no matter what state you're in, they have a certain list of federally required services that Medicaid has to cover. But because it's a state and federal program, states do have the option to tack on additional services on top of what the feds require. So mandatory services, Nebraska, of course, covers all of these. It's a long list. Didn't want to put all of it on a slide, but that's kind of the real basic services that you think of when you think of health coverage. Your regular physician's visits, hospitalization, items like that. Nebraska does have a fairly robust package of Medicaid services. We have opted to cover quite a few of those optional services as well. So that would be like dental coverage that Nebraska Medicaid covers, vision coverage, certain therapies, physical therapy, occupational therapy, and speech therapy, and also prosthetic devices as well. There's a complete list out on our website of all of the services that Nebraska Medicaid covers. Another group that is not quite as common, only some folks are eligible for it, but it's the personal assistance services or PASS services. These are for folks who, due to their medical needs, they may need to be in a nursing home at some point in time, but we like to do everything that we can to keep folks healthy, keep them at homes in their communities. It's a lot cheaper to keep people in their homes, and quite frankly, most folks would prefer to stay at home. So PAS services are some of those services that Medicaid can cover to help folks out, remain at home. These would not necessarily be medical services, but services that folks in a nursing home might need help with, like basic hygiene, mobility, medication, nutrition, kind of services like that. Those PASS services are most commonly provided through Medicaid waivers. Nebraska Medicaid currently has 4 of these. They're called waivers because the federal government allows Medicaid to cover kind of an additional group of services on top of the standard package of Medicaid services. They're most commonly grouped as home and community-based services because, like I was just saying, the primary purpose of these is to keep folks healthy and at home rather than moving them into a nursing home or some other sort of institution. So we have the age and disabled waiver, which is for either for seniors to help them stay at home or individuals with disabilities that their condition might someday require them to be in some sort of institution. Or the traumatic brain injury waiver, that's a smaller one. There's currently only one provider for the traumatic brain injury, the TBI waiver. That's QLI in Omaha. So if you're working with someone who has an injury like that, but they're here in Lincoln, the A&D, the age and disabled waiver, would be the waiver for those folks. We have 2 developmental disabilities, or DD waivers. There's an entire division at DHHS for developmental disabilities. They have a primary hand in these. We have 2 of them. The comprehensive DD waiver, that would provide care for individuals with developmental disabilities, provides them around-the-clock care, day and night. And then we also have a day waiver. Times it's for children, but not necessarily all the time. It's for individuals who they might have a caretaker, like a family member, who can take care of them in the evening, in the mornings. But if you have to go to work, that waiver can provide care to that person during the day. There's a number of different ways that folks can apply for Medicaid. We like to provide a number of options that best suits people's conditions or their situations. Of course, the most common way nowadays is to apply online through Access Nebraska. You can also do it over the phone. You can call into one of our customer service centers. A worker there can talk you through the application, take your information field by field, and fill out the application for you. Of course, you can always fill out a paper application too. Those are available at our local offices across the state. Or you can contact us. DHHS can mail out a paper application. You can fill it out and then send it back to us. Renewals work the same way. If you're on Medicaid, we do have to renew your case once a year. We basically offer all of those same options for renewing as well as your initial application. And this is just a quick screenshot of what Access Nebraska Online looks like. Underneath that yellow-green arrow there is where you apply for Medicaid. If you're working with someone who needs health coverage, Medicaid, but maybe also some additional benefits as well, such as SNAP, food stamps, Medicaid is a separate application, but those economic assistance programs like food stamps or energy assistance, that's a separate application from Medicaid, but all of those economic assistance programs are the same application as each other. So there'd be two applications that they would need to complete. So once someone is on Medicaid, we enroll them in the Heritage Health program. It's a managed care program that is operating statewide in Nebraska. Managed care is a system by which the state enrolls our Medicaid member in a health plan. We have 3 statewide. We pay that health plan a per member per month rate, and then after that, health plan is responsible for managing and providing all care for those members. So like I said, we do currently have 3 plans. They operate statewide, so regardless of where you're living in Nebraska, you have 3 choices of health plan. That's Nebraska Total Care, United Healthcare Community Plan, and WellCare of Nebraska. Managed care is, this program is relatively new. We're closing in on the end of its 3rd year. It launched in the beginning of 2017. But we did have similar managed care systems on a regional level before that. When someone is first enrolled in Medicaid, we automatically assign them to one of these 3 plans. There's a formula that takes into account providers nearby, kind of balancing out enrollment between the 3 plans, just a number of details like that. Members have 90 days to switch plans if they'd like. We give them that to everyone who first enrolls in Medicaid. And then on top of that, there's open enrollment. Usually lines up pretty closely with the marketplace open enrollment period. This year it's November 1 to December 15. And at that time, anyone who's on Medicaid, regardless of how long you've been on Medicaid, you can switch from plan to plan. The basic benefits between the 3 plans are identical. We require them to cover the full package of Medicaid services that Nebraska has agreed to with the federal government. The main difference, besides which providers are in the network, a lot of providers across the state will accept all of them, but there might be certain cases where the nearest doctor to where someone lives might only be on 1 or 2 of the plans. The main difference besides that is the value-add benefits. They're kind of like bonus benefits that the plans offer. These are things that aren't necessarily health services, but they kind of encourage healthy living. For instance, for children, some of them will offer like YMCA memberships or Boys and Girl Scouts memberships. For expecting mothers, it might be a lot of kind of the goods that you might need to get ready to have your child, bottles, diapers, things like that. But the basic benefits are all the exact same, so you don't have to worry about a certain service only being covered by one of these plans, but not other ones. And it looks like I got a little bit ahead of myself here. Open enrollment is coming up in just a few weeks here. There's a lot of information out there online that folks can compare plans, especially for those value-add benefits that I just mentioned. Out at anyheritagehealth.com, that's the dedicated website just for Heritage Health. A lot of great resources for that purpose. Like I mentioned earlier, Nebraska does also cover dental services for our Medicaid members. Those are provided outside of that Heritage Health system. Heritage Health plans, they cover all the behavioral, mental health, behavioral health, the regular pharmacy benefits, as well as your conventional physical health. Dental is provided through another managed care plan, MCNA, Managed Care of North America. They work very similarly to those Heritage Health plans. You join MCNA's plan, and then they coordinate all dental care, paid dental providers, kind of all those sort of details. I like to compare it. It's very similar to a lot of folks. If you receive health insurance through your work, oftentimes your dental plan is a separate policy from your commercial health plan. Works pretty similarly to that with Medicaid, but the members don't need to worry about paying, obviously. So Medicaid is dental is a separate plan outside of Heritage Health, but runs right alongside it. That is everything I wanted to discuss with you all today. So thank you.